Speaking of timers, we can actually use these to our advantage in a couple of instances. As an exercise specialist, when you start working with a patient, you might recognize pretty early on that that patient might not be good at counting repetitions that we've prescribed for them. As we said before, if they do too many, this can actually be a bad thing for their health in the long run. So we want to make sure they're doing the right amount. If you do notice this happening with the patient, again, ask the provider and say, hey, this patient hasn't done a very good job of counting the repetitions. We want to transition these over to time-based exercises so that we can help them be in charge of how long they're doing these exercises. What amount of times would you suggest on here? It's a great way to help us deliver better care for that patient. These could be patients that have memory issues or have other cognitive issues, but it can also be patients that you wouldn't expect. Sometimes patients don't seem to have any cognitive impairment, but for one reason or another, just get caught up in their thoughts and lose track of how many they did. You also have the overachievers who do think that if we ask them to do 20, then 40 must be better. And that's just not the case. So if you find that a patient's having trouble doing the right amount and counting, then let's make a switch and suggest to the provider to do some time-based exercises. We can also suggest time-based exercises for those who experience complicated or chronic pain. Well, what do we mean by that? Patients who have had a long-standing fear of movement because of pain. You'll notice these patients over time, and you'll get better with your training on knowing what fear-based movement looks like. They're people that are apprehensive to the point where it seems like their pain controls every movement in their body. If you suspect this, then talk with the provider, counsel together with them and say, hey, this patient might benefit from time-based exercises. There's a wealth of research that shows that time-based exercises for those with chronic pain tend to respond better to rehabilitation. So if you do catch wind of this and you feel like this person might be a candidate for more time-based exercises, bring it up to your provider, suggest it. Make us better at our jobs by giving us good suggestions. We'll be on the lookout for the same, but we rely on you as you do these exercises with patients to recognize some of these fear-based movement patterns. If you have questions on what those look like, ask a provider. We'll talk to you more about it.